And so now we will move on to our 6.11. This is our 12 noon Lake County Department of Health Services monthly update. And with us, I think, is Director Portney and Dr. McLaughlin. Hello.
How's everybody doing today?
Good. So far, so good.
All right. Well, I like to commend the board on struggling through without Miss Carol today. So well done. She is missed, though. So regardless, I believe Mr. Matthew was going to support me with some slide advancement, or would you like me to share my screen?
All right.
Oh, here we go. Outstanding. So I'll be brief. What I wanted to mainly draw attention to today was the fact that we are detecting some increase in COVID activity, not only in our county, but in neighboring counties and nationally. So you're going to see some slides up here that don't need a whole lot of explanation because they're very graphically well represented. We are seeing statewide and in our county increases in COVID activity. We've gone from about 2% positivity, 1.5% positivity to around 4.4% test positivity. So what this number means is everybody that we're testing for COVID, this is the percentage of them that are testing positive. Usually we start to get nervous in public health if that number is above 10%. That's starting to be a real big problem. Previously in the pandemic, we've had to deal with numbers as high as the low to mid 20% positive rates. So it is not an emergency. It is not an urgency yet, but I do want to make sure everyone is aware that we are seeing increases in activity. We're not quite sure how big this is going to be. Are we looking at another spike, or are we looking at a little bump on our journey through COVID? We are seeing an increase concomitantly, an increase of hospitalizations and death rates. So I'll address those in the next slide here. Go ahead, please. So here, looking at statewide averages, you can see these lines are indicating the increase in case counts. We are also seeing a slight increase in deaths as well as hospitalizations. So these are kind of the harbinger of things to come that stress our healthcare systems. Are people getting sick, or are people getting sick, hospitalized, and subsequently dying from COVID? We are seeing the increase in cases. We are seeing a slight increase in hospitalizations and deaths, but it has not been the ratio that we've seen previously with horrible surges such as Delta or the vanilla flavor Alpha in the very beginning. Next slide, please. So taking a look at this, the BA.212.1 variant, it's a horrible name for it. We always have a joke about what do you have to do to actually earn a Greek letter. But unfortunately, this one is kind of becoming the dominant strain here. We've been closely watching the hospitalization rates on the East Coast. And this is kind of our canary in the coal mine that shows us that what's happening there in New York and New England is now we're seeing in the Bay Area, and we expect that in our region in the next coming weeks. So you can see, and let me move my screen here, the hospitalization rates have really increased dramatically coming through the month of May in New York. Again, this is attributable to this newer variant, and we are expecting the hospitalizations to follow along here in the next week to 2 weeks. Next slide, please. This is a really good slide that I want to draw attention to here of community transmission. So you can see where we are, and you can see the more populated counties on the coastal regions. Obviously, we are seeing a large rise in transmission. To me, clinically, as a public health officer, I'm less concerned with communicability as I am who's getting sick from this, who's getting hospitalized, and who's dying. So we are seeing upticks in all of these, but it does not appear to be the serious threat we faced with the Delta variant. So this is a great graphic representation, but again, we typically lag behind a few weeks. Next slide, please. I'd like to just briefly touch on vaccination coverage in the county. We have 64% of our population fully vaccinated. 17,000 of those have received their booster. 16,000 are still eligible for their booster shots. So we have seen kind of what I would consider to be a stall in vaccine uptake. This typically means that we have burned through the population. We've vaccinated everybody who's interested in getting their vaccine. We are still providing vaccination services with multiple different modalities, but those that have been vaccinated have gotten so and are now moving through their boosters. I'd also like to present that the FDA approved boosters for the 5 to 11-year-old age group actually today, or perhaps yesterday, but I got news of it this morning. So next slide, please. You can see, oh, sorry, if you could go back one. There we go. 29% of our eligible population is unvaccinated. I would obviously like to see this much lower. This is by far the best way to prevent death or serious illness from COVID. I really want to stress that our vaccines, while they do not prevent illness or transmission spread, they do prevent you from dying from COVID very, very effectively. Next slide, please. One of the other ways that we're looking at COVID activity is with wastewater surveillance. I'm very proud of the fact that Lake County has wastewater surveillance. We're one of the few sites in California and nationally that is contributing data to this. Unfortunately, this does show gradual increases over the last few weeks across the state and in our county of increasing case counts. The ramifications of this are yet to be seen, but we suspect that it will have an increase in hospitalizations and unfortunately in death rates. Next slide, please. So here you can see our graphic representation of case counts and testing per 100,000. And you can see our 2.5% positivity rate reflected on the right side, which is up almost 1 full percent from the week before. Sitting around 2.5% is, while it's concerning to me, I would like it to be 1 or less. It's still not in an area that I would be ringing the bell for alarm yet. What is concerning is what we call the velocity. This is the increase. We're going up about 1% per week. And I'm in hopes that this will taper, but time will tell on this. Next slide, please. Case rates and deaths. We're averaging about 5.7 new cases per 100,000 per week. Fortunately, we have been spared those horrific deaths that we saw with COVID, or with Delta and with the Omicron variants, but chiefly with Delta and the Alpha variants. The clinical significance of this is yet to be seen. So we are watching this very closely and following a lot of data from the Bay Area and the ABAHO, the Association of Bay Area Health Officers, to get an idea of what is in store for us over the next coming 4 weeks. And I think we're up to the last slide. I'd like to draw attention to hospitalizations and ICU capacity. This is really, to me, where the rubber meets the road, is how taxed is our healthcare system. Our healthcare system is doing well so far. We are seeing slight increases, but again, nothing compared to this horrific hump we saw with the Omicron surge. And last slide should be the thank you slide. Oh, sorry, pardon me. This is an annual or multi-year layout of the original onset of COVID, showing the Alpha variant or the vanilla into Delta, that second hump, and then that horrific surge we saw of Omicron. Again, these are cases, not death rates, and not hospitalizations. So with that, last slide, please. I'd like to just dive into who's getting sick in our county. You can see that the highest rate of infections occurs in the 18 to 34-year-old age bracket, with about 15% of them. Just underneath is 50 to 59-year-olds, and we all should remember that COVID tends to have more severe disease and mortality with the elder age brackets, 50s and over. So this is extra reason to make sure that you're boosted, extra reason to make sure you're taking enormous precautions with distancing, wearing your masks, which does wonders to prevent spread of a respiratory illness, and ensuring that you are properly vaccinated and up to date with your boosters. Last slide. This is a retrospective look back at our Omicron surge with breakdowns of age group. Again, you can see the 50 to 64 age bracket was chiefly suffering in the Omicron, where we're seeing the 18 to 34 currently taking the brunt of cases. This falls in line kind of with the national averages of the individuals who are out more in the communities, participating in daily activities of work and things of that nature. And next slide, please. This was included in my request to do some comparison to Sonoma County, neighboring county, and again, that canary in the coal mine a little bit more for us. We are seeing their vaccination rates are a little bit better than ours, but they are also seeing steadily increasing case rates in unvaccinated as well as vaccinated patients. Their test positivity has also been steadily increasing. They are going up, as you can see here on the bottom graph, each day or each week, going up about 0.5% to 1%. Hospitalizations are remaining at the moderate level, and outbreaks are occurring now in multiple settings, including congregate livings and school districts. So I am suspicious that we are going to be seeing more cases in Lake County in the next 3 to 4 weeks. Again, I'm going to say that this is better reason to strongly use your mask to prevent this respiratory illness from spreading to others. And the best way to mitigate yourself from getting sick or dying is to ensure that you're vaccinated and properly boosted. Next slide, please. Thank you for that. I'd also like to draw attention to the fact that we are looking closely at concerns related to infant formula and the difficulty of accessing this, as well as some potential public health concerns with making home formula or diluting formula, which can have negative effects on young growing babies. We are also closely monitoring the pediatric hepatitis outbreak of unknown etiology, and following that closely, there's about 110 cases we've observed in the United States thus far, and about 12 cases in California. With that, I want to respect the board's time. I appreciate the opportunity to present. Please continue to wear your masks and ensure you're vaccinated. I'm afraid we're looking to an uptick in case rates and activity in the next 3 to 4 weeks. I don't know how high that will get. Happy to take any questions. Thank you.
Supervisor Simon.
Thank you for that report and that information, Doctor. When we move forward, and someone can help me with the new oral medications that have come out. There's a new oral substance in a couple of different counties where you go there, you test positive, you have an opportunity to take an oral opportunity if whether you're vaccinated or unvaccinated. So it doesn't matter what is, that's all new since we've been dealing with this. And so I'd like to know your thoughts and how we're moving forward with at least looking at that other opportunity to help combat the COVID-19 pandemic we're in, or endemic.
Yeah, no,
making sure I get
that's
the right
a great question, sir. So this is, I believe, a reference to the medicine called Paxlovid is the trade name for it. And this fits in with the federal administration, the Biden administration's test and treat concept. This is really being rolled out at the state level. And this involves, just like you said, it's the ability to go to a local pharmacy and present with symptoms or a desire to be tested. And if you are found to be positive at that moment, you can then get this antiviral medication that is showing a lot of promise in decreasing mortality and pushing back the severity of those symptoms. We are seeing some rebound on the Paxlovid, and that's getting a lot of attention right now, meaning you take it and complete your course and you do very, very well. Your symptoms abate. You're not hospitalized typically, you're not dying from it, but we are seeing when you come off the medicine, your symptoms are returning abruptly. And this is getting a lot of attention about how and why this is occurring. But those programs are rolling out and are active currently with local pharmacies, national chain pharmacies, I should say. And CDPH is doing a good job of promoting and coordinating that as well, sir. Great question.
Thank you.
Supervisor Pyska.
Yeah, I had 2 questions. Yesterday, Supervisor Simon and I heard from special districts about the testing at water treatment and that there's a lag in that data. And I couldn't remember what that lag was, so I'm wondering if you have that.
Yeah, great question. It's typically about 7 to 10 days. So what you're looking at with these lags is you're looking at time for the effluent or black water, if you will, to be collected in the system. Then you are looking at the collection of the test, and then you are looking at the processing of the test, and then you have the reporting back of the test. That generally gives us about a 7 to 10 day, what I would call lag. So our wastewater treatment is showing us this week, the data that we're looking at is going to be retrospectively about 7 to 10 days behind, which is pretty good if you consider that it is a very fiscally viable and very precise way of testing COVID activity on a population level. And I'm quite proud that Lake County is participating in this program. It really says a lot about how kind of switched on and proactive we are. But that was a great question. I saw Mr. Harder just jumped on.
Go ahead, Scott, if you have something to add.
Yeah, certainly. I think what Supervisor Pysko was referring to also was the fact that we have 2 of our wastewater treatment plants where we're performing that testing. One is in partnership with CDPH, and that's our southeast, which serves the Clear Lake and Lower Lake area. And the second is in partnership with the CDC at a federal level, and that is at our northwest plant, and that serves most of the North Shore and North Lakeport. Part of the lag that we're having as well is at the Northwest Regional Treatment Plant. The federal contract has changed lab providers or testing labs. And so there's a current lag and a current shortage. They're having some logistical issues getting us testing supplies. So at the Northwest location, we're probably 3 or 4 weeks with no testing because we haven't received the testing supplies yet at this time. But once those arrive, we'll get back into the twice weekly testing, and that data will then be available as well.
Okay, thank you.
Thank you for that, sir.
So my next question is about, reinfection, I guess, because we had such a significant surge in the winter, and now we have the subvariant, and then we have people that are vaccinated, and some people have 1 booster, some people have 2 boosters, some people have been infected, some people have been vaccinated and infected. So can you just kind of speak on all of those factors?
Yeah, so this all centers around waning antibodies. It doesn't really matter how you're acquiring your antibodies. Are you getting them from wild type disease, meaning I got sick over the winter, I got COVID? That buys you about 90 days worth of protection, provided that there is not a new variant that is able to penetrate through the antibodies you had from the previous infection. The same goes for vaccine-induced antibodies. So if you have been, let's say you completed your 2-dose primary series last year. Well, those antibodies have waned off significantly, we're seeing. This is why there is those recommendations for that 3rd dose, the first booster, or the second booster, 4th dose. The point is to try and keep that ball higher in the air, that antibody level up higher, so that you have good protection when your body encounters the wild type virus. I believe, and I think the literature supports, that this is why we are seeing an increase in cases now. We had that horrific Omicron surge in January, February-ish, and now we are starting to see the natural antibodies coming off. We're starting to see the vaccine-acquired antibodies coming off. So we're dealing with now a relatively naive population, meaning that they don't have a lot of antibodies circulating, and this new Omicron variant is able to get in there and do some damage. So I believe this is what we are looking at for the summer, and this is why we're seeing this cyclical peak and valley kind of concept when it comes to infections, is we're seeing those 3-month, 90-day windows in between where we have relatively honeymoon phase, and then as those antibodies wane out of our population, we're getting sick again.
Okay, and can you just remind us of the eligibility for the boosters?
So anybody, as of today, I'll go chronologically from 5 years and up. As of today, children 5 to 11 are eligible for a 3rd dose or a booster. Adults 18 and over are eligible for a third dose booster. Individuals 50 and above with immunocompromised states or medical fragility are eligible for a fourth dose booster. The timing on this, that fourth dose is important. And I think I've spoken about this before in the past, but there's two schools of thought on this. School of thought number one is get the vaccine while you have the interest and the availability. School of thought number two is wait until there is an uptick in cases and then get your booster because you're buying about a 90-day window. I think the information that we're seeing now is very much pointing to the uptick in cases and that this is the time to get your boosters. If you have not already, this is the time to start wearing your masks and keep wearing them so that you are not spreading this respiratory illness to other people. That was a great question.
With that, I'll open it up to public input. If you'd like to come up to the microphone and state your name for the record, 3 minutes.
I am Joan Moss. I want to ask a question that you probably won't appreciate. Members of my family who are vaccinated caught COVID in Wisconsin, and my daughter in Seattle caught COVID in Seattle. They're telling me to get vaccinated. I have my own regimen. But I want to know, doctor, if you or the state or anybody else has kept track of the people who are vaccinated who have caught COVID. And if you have a specific number of people who are vaccinated and boosted and died, if you have any specific facts about that, I would like to know. Thank you. Obviously, I don't take the vaccine that you want, but I have my own regimen. Thank you.
Am I allowed to reply?
Yes, yes, sir. Yes, doctor, go ahead.
That's a great question. I think that kind of question needs to be asked. This is the question that we ask as doctors and scientists every day. I don't have that number in front of me, but I have seen it and I know it is being tracked. Not only, what you're referring to is what we call vaccine penetration, disease penetration into vaccinated populations. You can be vaccinated and completely boosted and still get sick. These vaccines are not a suit of armor that gives the 98% protectivity that we've gotten accustomed to with other vaccines like hepatitis A or the MMR vaccine. The vaccines are really good at preventing death and severe disease, but aren't as good as we would like them to be when it comes to preventing people from getting sick or having a carrier status and then being able to spread that disease to other people. I do know that we are unfortunately seeing an increase in deaths of vaccinated individuals over the last 3 to 4 months. I don't have that information in front of me and I don't want to shoot wildly from the hip, but I can certainly dig that up here very quickly. But you are 100% correct, ma'am, in the fact that just because you're vaccinated and boosted does not mean you're going to escape getting sick. And it unfortunately doesn't always mean that you're going to escape dying from COVID. This brings me back to the importance of masking, and the best way to not die from COVID is to not get COVID. The second best way to avoid dying from COVID is to be vaccinated. There are no 100%, and I think that was a very valuable question, and I welcome the chance to share that kind of information. Sadly, the vaccine is good at preventing death, but not 100%, and the vaccine does have limits with respect to allowing other people to get infected and spread the disease. It's good technology. The ability of the mRNA vaccines has come light years in 2 years. And it is one of our best weapons at preventing disease and death in our populations. But I do think you raised a great, important question, and I applaud that. Thank you, ma'am.
All right. I'm not seeing anyone else in the chambers, and I don't see anyone online, so I'll bring it back to the board. And Supervisor Sabatier?
Yeah,
Close
just-
public input.
Just wanted to respond to that last question. If you go to California Department of Public Health, CDPH, there's a dashboard, shows all the cases, shows all the deaths, but it also shows vaccine rates. Underneath the vaccine rates, there's a link you can go to find the raw data for how many people in the state of California have not been vaccinated, and boosted. And then it shows you also the deaths and the hospitalizations for unvaccinated, vaccinated, and boosted. And you can find those numbers there yourself. And the numbers are striking. They're striking. The difference between an unvaccinated and boosted is quite different, but also it depends on the variant that you're dealing with because the vaccine was made originally for the alpha. So it changes, but it's still a striking difference between unvaccinated and boosted.
Thank you for that, sir.
All right.
I didn't want to
According to
interrupt you. Go and
CDPH.
collect that data. I appreciate you sharing that link. Thank you, sir.
All right, are there any other comments or anything you would like to close with, Doctor?
No, be good to each other. Wear your masks. If you're eligible for vaccination or boosting, take advantage of it. And please stay tuned to us on social media and our outreaches as we're going to be doing regular updates on disease activity. Thank you. Stay safe.
Thank you.
See you in June.